Hi, my name is Bryce Christensen. In this video, I am going to tell you the number one thing to help plantar fasciitis from the comfort of your home that is free, affordable, portable. You can take it with you wherever you go. Before I give you that information, I want to give you a little bit of background of how I discovered this and give credit where credit is due, and give you a little bit about my background. Now, I'm a chiropractor. I practice in Western Colorado in a town called Grand Junction, and we have a fair amount of active people here who are runners and cyclists and hikers, and they often develop foot pain. Now, I believe there are treatments out there that are better than others. However, the number one treatment based on the affordability, portability, and effectiveness is proper education. And we have a whole program, educational program, to help fix and solve plantar fasciitis, heel pain, and foot pain. But we can distill it down to the number one thing, and I can't take credit for this because I had an exceptional mentor that taught me this. Now, as a chiropractor, we primarily treat spinal issues and musculoskeletal things as well, but most people think of lower back pain, neck pain, headaches, whiplash when they think of a chiropractor. And we see that. Low back pain is the number one thing that we treat in my office, but the thing that we have the best success with is plantar fasciitis. And in the past, we used to do a lot of treatment in-house. However, I saw a pattern with my patients, and the ones who executed what we have them do at home far surpassed the people that relied on us to provide treatment. So in 2017, I was planning to record a class. So I'm in my classroom right now where we teach a class called Plantar Fasciitis Gone, and we do it numerous times throughout the year. And in 2017, we took three of our new patients that had plantar fasciitis, and we asked them, hey, before we do any treatment here, will you execute these home exercises and see how they do? And we took three of them, really, really bad cases, and all three of them got above 90% better without ever needing treatment in the office. Now, a couple of them came in and got a handful of treatments and are doing really, really well now. However, all three of them were able to get over 90% improvement without ever needing treatment. And so we have been in the process of putting this into an online class for a couple years now and making it available. We are in the process of doing that now. However, I just want to give the number one thing that you can start doing immediately without having to go through the whole class, which we plan to have online here shortly. Now, a little bit more about my background. When I went to chiropractic school, I was very enthusiastic about the profession. I knew that the profession had some quirks about it. However, I continued to choose that route over physical therapy, orthopedics, and sports medicine. And through the first couple of years, things were going really well until I really saw some of the ugly practices in chiropractic. And so when I was getting ready to graduate, I was very, very concerned that I had made the wrong choice. And if it weren't for having a connection to a really good chiropractor, I don't know if I would still be a chiropractor. So in chiropractic school, the last term is what's called a preceptorship. And you have to go out and get a preceptorship on your own. You have to find a doctor to work with you as an intern, and you have to do it, you have to treat it like a job. And I went the easy route. I just went to one of my oldest brother's friends, and I knew a little bit about his practice. I knew he liked soft tissue injuries and treated a fair amount of athletes. And that's one of the things that I wanted to do, is I wanted to help runners, triathletes, and active people with soft tissue injury. So I went and talked to him, and he was nice enough to take me on as an intern. And he had just come through his first internship, so he had a little bit of experience. And he was a 31-year-old chiropractor in Minneapolis, Minnesota, and had very reasonable expectations for it. But on my first day in his office, I was blown away. He had a 27-year-old from Paris, France, fly all the way to Minneapolis for treatment for plantar fasciitis. And that's when I realized I really needed to take notes on what he was doing. And throughout the 4 months that I was practicing underneath him or interning underneath him, we saw multiple people come to Minneapolis to see a 31-year-old chiropractor from all over the world. And this 27-year-old patient was in the first week and then the last week of my internship, and I'll never ever forget hearing her story. She was a 27-year-old from Paris, France, had been to numerous doctors throughout Europe and couldn't get better. And Dr. Sandell, Josh Sandell was my mentor's name, was able to get her well enough so that last week when I was in his office for my internship, he had her running on a treadmill barefoot for 45 minutes. Now, if you talk to someone with plantar fasciitis and you talk to them about walking barefoot, they will say, no way, I will not do that. It hurts my feet so much. And this gal was not only walking barefoot, but running on a treadmill barefoot for 45 minutes without any trouble. And so I want to distill down the number one thing that he taught me, and I still believe is if you take away all other treatment options and all other home exercises, this is the number one best thing that you can do to start helping plantar fasciitis. So the number one symptom is pain getting out of bed in the morning. And so the number one solution is trying to prevent that reinitiation of pain first thing in the morning. So what we do with our patients is emphasize this on visit 1. Before you get out of bed, you have to prepare your feet to bear weight, because you're horizontal, your tissues are trying to heal overnight. And if you go from that trying to heal phase with your soft tissues to weight bearing without any preparation, movement, or warm up, you're going to perpetuate the cycle of what keeps bringing on the plantar fasciitis. So what we have our patients do is before they get out of bed, they roll onto their back, they take their ankle and toes and they push them down and then up and then down and then up, and do that back and forth, and do a couple little what we call windshield wipers, and just loosen up the tissues in the foot, the toes, and the lower portion of the lower leg. If nothing else, if you can start doing that, you'll start to feel better. You'll feel more mobile. You'll have less pain that first step out of bed in the morning. And stay tuned, because we're going to go over our whole class, Plantar Fasciitis Gone, on our YouTube channel and share it with everyone. So hang tight. There's more to come. I just wanted to share this one initial tip right away as part of a collaboration effort that I'm doing with my peers. And so implement this now and tell me how it feels. Give us feedback and comments, and we'll be happy to answer your questions.